Clinical trials are research studies that involve people. They are the final step in a long process that begins with laboratory research and testing in animals. Many treatments used today are the result of past clinical trials. When thinking about clinical trials, your best starting point is your doctor or another member of your healthcare team. Usually it is a doctor who may know about a clinical trial or search for one that could be a good option for you and your type of cancer. He or she can provide information and answer questions while you think about joining a clinical trial. In some cases, your doctor may not be taking part in clinical trials or may not be very familiar with them. If your doctor doesn't have information to give you about clinical trials, you may want to get a second opinion about your treatment options and about participating in a clinical trial. If you decide to look for a clinical trial, you must know certain details about your cancer diagnosis. You will need to compare these details with the eligibility criteria of any trial that interests you. Eligibility criteria are the guidelines for who can and cannot take part in certain clinical trial. To help you know which trials you may be eligible to join, complete the cancer details checklist as much as possible. This form asks questions about your cancer and provides space to write down your answers. Keep the form with you during your search for a clinical trial. This is available on clinicaltrials.gov. The United States, some trials are sponsored by nonprofit organizations, including the U.S. federal government, and others are sponsored for nonprofit groups such as drug companies. In addition, there are hospitals and academic medical centers that sponsor trials conducted by their own researchers. Unfortunately, because many of these types of sponsors, no single list of clinical trials is complete. The United States, including the NCI designated cancer centers, sponsor or take part in cancer clinical trials. The websites of these centers usually have a list of the clinical trials taking place at their location. Some of the trials included in these lists, mainly phase 1 clinical trials, may not be included in other websites. Keep in mind that the amount of information about clinical trials on these websites can vary considerably. You may have to contact the Cancer Center Clinical Trials Office to get more information about the trials that interest you. See a list of NCI designated cancer centers. Another place to look is Trial Check AE website. This website is managed by an organization called the Coalition of Cancer Cooperative Groups. The CCCG includes groups of doctors and other health professionals who can conduct many of the large cancer clinical trials sponsored by There are many ways to contact the clinical trials team of any particular clinical trial. Contact the trial team directly. The clinical trial summary should include the phone number of a person or an office that you can contact for more. Ask your doctor or another healthcare team member to contact the trial team for you, because the clinical trial coordinator will ask questions about your cancer diagnosis and your current general health. You may want to ask your doctor or someone else on your healthcare team to contact the clinical trial team on your behalf. The trial team may contact you if you have used the website of a clinical trial listing service and found a trial that interests you. You may have provided your name, phone number, and email address so the clinical trial team can contact you. Whether you or someone from your healthcare team calls the clinical trial team, this is the time to get answers to questions that will help you decide whether or not to take part in this particular clinical trial. It will be helpful if you can talk about your cancer and your current health in a manner that is brief and to the point. Before you make the call, you may want to rehearse how you will present key information about your cancer diagnosis and general health with a family member or a friend. This will make you more comfortable when you are talking with the clinical trial team member, and it will help you answer his or her questions more smoothly. Remember to keep your cancer details checklist handy to help you answer some of these questions that you may be. To make a final decision, you will want to know that the potential risks and benefits are of all treatment options available to you. Through the research that you have done, you will likely have a good idea about the possible risks and benefits of that treatment in clinical trials that interest you. If you have any remaining questions, you should discuss them with your doctor. You should always ask your doctor about the risks and benefits of standard or usual treatment for your type of cancer trial. You may decide that joining a trial is your best option, or you may decide not to join a trial. It's your choice.